he's still at the White House, so we'll just, we were going to have him go next, but we'll just go to questions. This bill, the American Health Care Act, it keeps our promise to repeal and replace Obamacare. It delivers relief to Americans fed up with skyrocketing premiums and fewer choices. It moves us away from the broken status quo toward a better, patient-centered system. That means lower costs for hardworking families. It means more choices and competition so that you can buy the plan that you need and that you can afford. It means greater control of your health care. As you know, this is the culmination of years long of an inclusive process that we've been doing here for years. So I'm excited that we're doing this the right way. I'm excited we're doing this out in plain sight. Go to readthebill.gop. What I want to tell my fellow citizens is that the nightmare of Obamacare is about to end. That we are doing what we said we would do in this campaign, which is repeal and replace this awful law that is crashing. Let me say one more thing. Let's not forget, Obamacare is collapsing. Obamacare isn't staying. If we did nothing, the law would collapse and leave everybody without affordable health care. We are doing an act of mercy by repealing this law and replacing it with patient-centered health care reforms that we as conservatives have been arguing for and fighting for years. For 20 years, we as conservatives have been arguing for equalizing the tax treatment of health care for all Americans so we can have a vibrant individual market so we have choice and competition. Look, there are two ways of fixing health care. Have the government run it and ration it and put price controls. That's what Obamacare does. That's what the left wants. Or do what conservatives have been arguing for years. Have a vibrant free market where people get to do what they want. They buy what they want. Equalize the tax treatment. Stop the discrimination in the tax code against people who want to go out in a free marketplace and buy the health care of their choosing. This does that. This lowers costs, creates competition, it allows choices. The most important thing that this thing does is it takes power out of Washington, takes power out of the bureaucracy and puts it back to doctors and patients where it belongs. Look, what matters is that we're lowering the cost of health care and giving people access to affordable health care plans. Look, the government will always win the war on government-run plans saying if we mandate everybody buys what we say they have to buy, then the government will always estimate that they'll buy it. I just think that's bogus. That entire premise of that comparison doesn't work. The fact is, we're not going to have the government tell you what you must do, tell you what you must buy. We're going to allow the market to do that. We're going to let people decide what they want to do with their lives.
Look, we're going to make sure that those who have pre-existing conditions continue to get health care and health insurance. We're going to make sure that there are no lifetime caps, and we're not going to kick your kids off their plans until after they turn 26. We'll help you kick them out of the basement, maybe, but not off their health insurance. This is important work we're doing. We look forward to moving forward on it and to providing the rescue for the individual market and relief to the states and help to the people that sent us here to get this job done.